In a more chronic settings, there's a patient management system that can seamlessly survey patients with abdominal aortic aneurysms and also improve overall care of the patients with abdominal aortic aneurysm. So once the image was identified and confirmed by radiologists, it populates in the patient management system. And from there, we have an opportunity to identify patients and prioritize patients that need appointments and need to be notified. The patient's list is being evaluated for presence of abdominal aortic aneurysm in the past, if it was known finding, and then if it's a new finding, notification of primary care physician or ordering physician is done right now manually by our care coordinators. Next slide, please. We can designate specific size at which point we would like to bring these patients for appointments. At present time, we evaluate mostly patients above 4 centimeters. Those that between 3 and 4 centimeters routinely would be scheduled for follow-up imaging per Society for Vascular Surgery guidelines in 3 years. Patient management system allows you to separate those patients and set up appropriate alarms to activate those patients at the time when their follow-ups are needed. Next slide, please. It has capability to filter patients based on desired preferences of the practitioner. It can filter patients based on size, as I mentioned, between 3 and 4, 4 and above, or you can choose 5 millimeter threshold. It can sort patients by age, presence of prior reports from radiologists. So if the aneurysm was mentioned in the past, that you simultaneously can see that it's been already diagnosed versus like no prior studies in your system. Also, it can show you if the patient had any operation performed. So if a patient had endovascular AAA repair, it will sort it in a different category. And also can help you to identify a referring provider, so you can see how many patients from certain provider you have in the system.